Welcome back to Midweek Politics. I'm David Pakman. Please visit us on YouTube, youtube.com/midweekpolitics. Check out the video version of the show and plenty more, including interviews from the last 4 years of Midweek Politics. Well, John Boehner and Charlie Rangel have squared off about this government funding of abortion issue in the healthcare bill. And let's take a listen to this exchange they had on the House floor the other night. And this was what some are calling one of John Boehner's more childish moments, asking Charlie Rangel for an assurance about what will come out of the conference committee in the final bill. So to get people up to speed, there's the House bill for healthcare. Then the Senate will come up with their bill, and then they will go to conference to come up with what presumably will be the final bill that they can vote on and get to the president of the United States to pass, in this case, Barack Obama. Here's John Boehner and Charlie Rangel talking about this abortion issue.
Do I have your guarantee that when this bill comes back from committee, that if the House does in fact pass the Stupak language outlawing funding, taxpayer funding for abortion, will you guarantee me when it comes back it'll be in the bill? I'd be happy to yield.
Mr. Leaders, you've been here long enough to truly understand how this system works. As soon as we pass this bill, then we would expect the Democratic-controlled Senate to pass their bill. And then we will go into conference. And we will work the will of the majority in the House. We have no idea that you would expect that a member, especially one that you spoke in such glowing terms of as you have about me, that you would expect me on this floor in front of all my friends and colleagues to guarantee you anything. And I think any member that gives a guarantee might be in violation of our ethics laws. And so I wish you kind of take another look at this thing before you ask.
Gentlemen, reclaim this time.
In reclaiming my time, Mr. Rangel, if the House does in fact vote for the Stupak language, and in conference, do I have your guarantee that your vote will be in favor of the Stupak language?
Well, I haven't normally cut any deals with you as a Republican, but why don't you talk to someone on your level in the House leadership as you have in the past?
My time, Mr. Speaker. This is exactly
so rude. Why don't you?
Okay. By the way, Charlie Rangel should know a thing or two about ethics rules, since he is the guy who was giving money to the same people that turned out to be investigating him. A bizarre situation, but nonetheless interesting to see the back and forth in the House over this abortion bill. Or this abortion amendment, rather. Now, some people, Lewis, say everything is bigger in Texas, and it turns out that the failure of their healthcare system is no exception. Texas is dead last in access to healthcare, with 25%, 1 out of every 4 people in Texas, are uninsured. For those who have healthcare in Texas, which is only 75% of the people, the quality is pretty bad, and it's number 46 in the country. Not good. That's out of 50 states. This comes after Texas Governor Rick Perry teamed up with Newt Gingrich, quite the duo, to write an article about why the proposed healthcare reform won't work and what they're doing in Texas. I would ask, how's that working out, what they're doing in Texas? Really not well. If we look at which states have the most to gain from the potential healthcare reform, Texas is at the top of the list. More than 3.5 million people would be newly insured. It would save over $243 million in Texas alone. And it seems, it's amazing to me that those with the biggest incentive in terms of their constituencies, those with constituencies that would stand the most to gain from this healthcare bill, seem to be the most against it. And there's a couple of reasons for that we can talk about. Another criticism of the healthcare bill is that it's so long at almost 2,000 pages. I mean, people are criticizing the fact that it's a very long bill. The number of pages in the bill. That's not very much longer than one of those Harry Potter books, isn't it? I mean, those are like 2,000 pages, I think.
I've never read one.
I haven't either, but I know that they're, 4 or 5 inches
I'm
thick.
sure if you've read the whole series, you've hit 2,000 plus.
I think some of the individual books are probably 1,500 pages. Well, CNN has finally discovered that this red state healthcare disaster is, in fact, what it is. And this is from Anderson Cooper 360. Healthcare is generally the worst in these red states where Republican politicians are opposed to reform. Take a listen.
Anderson, here's what we found out today. There are more uninsured in red states than there are in blue states, which is interesting since all Republican senators are expected to vote against the public health care option. Now, take a look at this map here behind me. According to the U.S. Census Bureau's latest numbers for 2008, these 4 states have the greatest number of uninsured residents. That's Louisiana, Florida, New Mexico, and Texas. In Louisiana, 20.1% are without health insurance. And then if you take a look at Florida, they're coming up next, 20.5% no health insurance. In New Mexico, 23%, even.
Okay, so CNN figuring out that this is in fact the reality. So in other words, the politicians from states with the worst current healthcare situations and the most to gain from proposed healthcare reform are the ones who are most feverishly against them. This could be looked at in 2 ways, I think. Number one, maybe they're so strong in their belief of their principles that they won't make decisions that would help their constituents on the surface if they think the underlying principles are poor. So there should be no public option. So I don't care if it'll help my constituents in the short run. I need to do what's right and what I feel is the moral thing to do. Or they're simply catering to what lobbyists, insurance companies, and other special interests want rather than their constituents. In either case, they're not making the right decision, are they? I mean, they need to be doing what is best for their constituents. And very clearly, specifically with Texas, what would be best would be wholesale healthcare reform with a strong public option, not the watered down thing that seems to be getting worse every single week.
Well, I'm sure they'd tell you that they think that in the long run, they're doing their constituents a favor financially. But I think we both disagree with that.
I would certainly disagree. Bernie Sanders, who is a senator from Vermont, he's taking a far opposite view than Joe Lieberman. He's saying he would consider filibustering the health care bill if it doesn't include a public option. Here's Bernie Sanders saying exactly that.
What I'm saying is that if the bill ends up being nothing more than hundreds of billions of dollars in subsidies for the insurance companies and the drug companies, if it's not affordable for the middle class, if we don't have a public option widely diverse so that people all over this country can enjoy it, then I think it's not worth proceeding. And I'm going to fight very hard to make sure that we have those aspects of the bill in there.
So we'll see if he does end up with an actual filibuster if the public option isn't in there. And again, I'm completely ashamed of the public option that now would be passed. It's a complete joke compared to some kind of real, reasonable government option. It's nowhere close to what the Medicare help plans are. It's nowhere close to what the plans that are members of the military get. It's a very watered down plan that who knows if it will even pass. And if it does, I'm not convinced that it will be any great victory.